But first, we begin with the politics of health care debate. U.S. Congressman Bob Inglis is a Republican from South Carolina. Congressman, what is going on out there in the country right now? Why all these disruptions at meetings like yours?
Well, of course, I'm happy for people to come to town meetings. We had a great town meeting the other night, 350 people there. And some were there to express their very strong opposition to the bill. Opposition, in some cases, turned into hostility, and hostility turned into hysteria for a few. So we had a pretty wild time, but by and large, it was a good event.
Well, let's take a listen at what happened at your event. We have a tape of that, sir. Thank you, Congressman.
A great suggestion up here. The suggestion to watch Glenn Beck. Here's what I'd suggest. Turn that television off when he comes up. Let me tell you why. You know why? Hi, Bob. It's trading on fear. And you know what? Here's what I think. I think if you trade on fear, what you're doing is you're not leading, you're just following fearful people.
Well, who do you think's stirring up all this noise? Because that's not a discussion, that's not a debate, which we need in this country. That's a screaming fit against you.
Yeah, that turned out to be quite a screaming fit right there. Well, I think that it is true. What we have to do is we have to figure out a way to get past the fear here. There are people out there that are selling fear, that trade on fear, and the result is that there isn't a good discussion. There are a lot of things to discuss in this healthcare plan, and there are many reasons to be opposed. In fact, I sent out a press release last week saying 16 reasons to be opposed to Obamacare. The top one being that the public option will put private insurance companies out of business, I fear, and the result will be that we end up with a single-payer system. That's a problem with the Obama package. But that doesn't mean we need to be hysterical about that. What it means is we need to have a reasoned debate and say, these are our objections, and now here's what we could do that's a positive alternative to that. And I think if we could get past some of the hysteria and get the president open to dropping the public option, we could actually get to a solution.
Well, would you vote for it if he did?
If he dropped the public option and if he made it clear that there wouldn't be funding for abortion within the package, then I think what's left is actually something we can work with.
Yeah, let me just try
to do.
Well, you're a Republican, sir. You're from South Carolina. Let me ask you a couple things if they're good. So we get back to substance, and I know that's where you want to go.
Yeah.
Is it good to try to require young people who are healthy to join into some kind of health insurance like we did with car drivership? We have to get insurance to drive a car. Is it good to get everybody in this together so the young and healthy share the cost of health care with the old and unhealthy? Is that a good thing?
Yes, an individual mandate makes sense. Yes, it does.
What about the idea of subsidizing in some way health insurance and getting people who have less than an average income, but they're not poverty-stricken, to start participating in their own health care by paying something and getting some help in doing so? Is that a good idea? In other words, get people off their...
Sense.
Okay. What about the idea of encouraging employer, not mandating, but encouraging employer contributions to health care?
Well, what I'd like to do, it may make sense if you can perpetuate a system of employer-provided insurance. I'd like to break that connection and have a system where we own our own insurance. But as long as we're saddled with an employer-based system, it makes sense to incentivize employers to provide insurance.
How about some kind of national clearinghouse like they advertise on these networks like Priceline, where a person can, without killing themselves, can do a little shopping and get the best deal, the best coverage for their situation? I think that's one of the things they're talking about doing. That's the last thing I want to talk. What do you think of that idea?
It's a great idea. In fact, John Chaddick from Arizona, a good Republican out there, has a great idea like that. It basically is a national system of competition among insurance companies. That's a bill that I'm on. It makes a lot of sense. It's an example of something we can work together on to get done in this Congress.
Well, I can't vote in South Carolina, but you got my vote, sir. Thank you very much for coming on the air tonight and talking. No, I mean, I'm not a bit patronized. I love politics, and I love politicians who have the guts to do what they have to do. If you're on the political right, fair enough. Let's hear the arguments. Thank you, sir. Congressman Bob Inglis of South Carolina.